Hi, I'm Dan from Correct Osteo Clinic, and today I just wanted to talk to you about what to expect on your first visit to see us here at Correct Osteo Clinic. So when you obviously you book in, you'll turn up, and what I'll do is I'll obviously meet you, I'll say hello, introduce myself and so on. I normally ask you if you want to drink tea, coffee, glass of water, soft drink, that sort of thing. Make sure that you're all comfortable. I'll ask you to then sit down at a desk, and then what we'll do is I'll ask you if you've seen an osteopath before. So if you have, it normally sort of sets me up to sort of suggest that you may have been through this process before, so you might understand some of the procedures that will take place during our consultation, assessments, and even treatment as well. However, what I will end up doing anyway is explaining to you exactly what to expect on your first visit, like I am now. So what we do is we go through a consultation form. So I'll show you a consultation form. I'll explain all the little parts about it. Normally the first part of the sheet is more for why you're here. So site of pain or discomfort, or any sort of sensations that you might be feeling. You might not even be in any sort of pain. You might have something on your mind. There might be something worrying you. Or even you just want to come in and get assessed, or even just general sort of osteopathic treatment. So we'll sort of anyway go through this consultation form to the best we possibly can. So the first part is sort of site of, say, that pain, discomfort or sensations that you're feeling, the onset, characteristics, duration, sort of frequency of it, and any sort of radiations that you might be getting, so pain that travels anywhere else. Aggravating, relieving factors, non-affecting factors, any sort of medication that you might be on, previous treatment, that sort of stuff. So does it progressively stay the same, worse, better? Then what we do, we turn the page over and I'll show you the second part. So this part may seem irrelevant. I always say to the patients that please bear with me through this part here, because it's more talking about your visceral signs and symptoms. Okay, so we screen you for any sort of serious conditions as well. We don't ask you specifically like, oh, how's your heart doing, or how's your liver. We ask you specific specific questions, that could indicate signs or symptoms of any sort of conditions that might be related to why you're here at the clinic today. So we sort of like screen you for any nasties really, and that sort of thing. Very simple process and quite straightforward. Obviously that depends on the patient's medical history and the extent of what that goes through. We go through things like daily pattern, sort of additional information, and any examinations that you might have had done as well previously in the past. Things like X-rays, MRIs, blood tests for any particular reason. So we sort of go through that side of things along with obviously your visceral health, like I explained earlier. The back part of this form is more of a consent form. So what I'll go through, obviously, all your consent for examination and treatment as well. So we need to get your consent before we obviously go through all this form anyway. So I'll explain that all to you, make sure you're sort of happy with that. If you have any further questions that you might have about the form, or even about what we're going to do on your visit here as well. Make sure you're all happy, sign the consent form, so on, and then we can then proceed with this stuff here. The back of the form, just above that as well, is more just about sort of smoking, alcohol, recreational drugs, and any sort of family history of any genetical sort of disorders and so on that we try to rule out as well. Okay, so this is all private and confidential under the GDPR Acts as well, so no one sees this apart from ourselves at the clinic, or if you like us to liaise with like your GP, doctor, another medical or health professional as well, but we always get your consent to do so before we do anything like that. The very back of this form is then the examinational process. So after we go through all the consent forms, we go through all your consultation, your medical health and so on like that, and you're happy, you understand why we've gone all through that as well, we then go into an examinational process. So I explained to you as well about the examination. So we do a standing exam, We do what's called palpation. It's just a terminology for sort of touching landmarks on the body to look for things like asymmetries and so on. We then go into active range of movement, so that means you move and we sort of assess how you're moving, and then we do passive range of movement, so that means we move the joint for you to see how it moves without things like muscular activation and so on. Okay, we do things like orthopedic testing. So orthopedic testing is sort of tests that might re-elaborate signs and symptoms of the issue that you've come to see us for, to give us a better understanding as to why it's happening. We then go through a working diagnosis. So what I like to obviously always explain to my patients is why I feel that it's happened and what has actually happened as well. So I want to make sure that you're completely comfortable, you're completely understanding as to what's going on as well. So say if you did have some sort of pain or so on, I want to make sure that you completely understand why it's happened and what it is as well. So we actually give you that sort of diagnosis. We could then come up with a treatment plan as well. So I'll explain to you how I would like to progress to treat as well yourself, and try to treat those signs and symptoms as well that you might be getting. Try and get you out of, say, like discomfort or so on like that, to make sure that you're completely, again, comfortable with that procedure. If I feel like I cannot, or another practitioner cannot, that works here, that cannot help you in that sense, we try to make sure that your health is taken into priority and refer you to someone who can. We all know our limitations in practice. Obviously, we can't know everything, we can't treat everything, and that is where teamwork makes the dream work with other healthcare professionals. So I'm sure we can put you into the hands of someone who can help you if we are not able to. So yeah, we make sure that you're completely understanding, you're completely comfortable, and then if all is well and we come up with a treatment plan and you're happy and it's something that we feel like we can help you with, we then proceed to treatment. So on your first visit, this is if you'll obviously book the consultation, assessment and the treatment side of things, and then we progress into treatment.